let's talk about something really important, knowing the signs of breast cancer. It's one of those things that can literally be life-saving. But what are we actually supposed to be looking for? Well, over the next few minutes, we're going to break it all down, the key symptoms, what they mean, and what to do, so you can feel totally empowered about your health. All right, let's dive. So just to put this into perspective, take a look at this number. We're talking about over 200,000 people diagnosed with breast cancer in the US every single year. That is a massive number, and it really drives home why being informed isn't just a good idea, it's absolutely critical. Okay, but here's the thing that really catches people off guard, and honestly, it's the most important reason to pay close attention. It's super common for early-stage breast cancer to have, well, no symptoms at all, zero. And that's exactly why things like awareness and regular screenings are your absolute best defense for catching it early. So here's our game plan for today. We'll kick things off with some key facts you gotta know first. Then we'll get into the most common sign, other changes you can actually see, and some of the less common symptoms. And we'll wrap up with the most important piece of the puzzle, when to see a doctor. All right, section 1, what to know first. Before we jump into the symptoms, let's lay down a solid foundation with some key facts and the very latest screening guidelines. So let's start with the basics. What exactly is breast cancer? Well, in simple terms, it's when cells in the breast start to go rogue. They become abnormal and just grow completely out of control. This can start in a couple of places, like the milk ducts or the lobes, and that uncontrolled growth is what can form a tumor. Okay, and this right here, this is a huge deal and a really recent change. As of April 2024, the official guideline is now for women and people assigned female at birth to start getting mammograms every 2 years starting at age 40. Now, you might remember the old guideline was 50, so this is a major shift, and it's all about catching things earlier. All right, moving on to section 2. Let's talk about the sign everyone thinks of first, a breast lump. Now, the first thing to know is that most lumps are actually benign, meaning they're not cancer. So, deep breath. But it's still so important to know what kind of lump might be a cause for concern. So, what are we looking for? Well, a concerning lump often feels hard. Think of a small pebble. It's usually got an irregular shape with rough edges, not smooth and round. Another key thing is that it feels fixed, like it doesn't move around easily when you touch it. And while a lump can show up anywhere, you'll most often find them in that upper outer part of the breast, kind of close to your arm. Okay, on to our third section. It's not all about lumps you can feel. There are also signs you can see. We're talking about visual changes to the skin, the nipple, and even the overall shape of the breast. First up, let's talk about skin. Sometimes cancer can really change the look and feel of the skin on the breast. So you might see things like thickening or swelling. A really distinct one to look for is dimpling that makes the skin look kind of like an orange peel, you know that texture? Also keep an eye out for any redness you can't explain, a dry or flaky rash, or any kind of puckering or denting in the skin. All right, next, let's focus on the nipple and the areola. That's the darker area around it. This part of the breast can show some really specific signs too. The big things to look for here are any kind of discharge that isn't breast milk. It could be clear, brown, or even bloody. Another major one is something called inversion, which is when a nipple that used to point out suddenly turns inward. And just like with the skin, any new dryness, fleeking, or scaling on the nipple is something to watch. And finally, just take a look at the overall shape and size. Now look, it's totally normal for one breast to be a little different from the other. But what we're talking about here is a sudden or really noticeable change in the size or shape of one breast. That's a potential warning sign. Okay, time for our fourth section, where we'll cover some of the less common symptoms. They might not be as frequent, but they are just as important to know about, including signs of more advanced cancer and breast cancer in men. So when breast cancer spreads outside of the breast to other parts of the body, that's called metastatic, or stage 4. And at that point, the symptoms aren't just in the breast anymore. You might experience things that seem totally unrelated, like bone or joint pain, bad headaches, vision changes, or even a chronic dry cough. These are signs that cancer has traveled. But what about breast cancer in men? You know, it's something we don't hear about as much. It is very rare. We're talking less than 1% of all cases, but it happens. For the most part, the symptoms are pretty much the same. You're looking for lumps, skin changes, nipple discharge, all of that. But here's the one key difference. For men, a change in the overall breast size or shape is not a common symptom. Phew, okay, we've gone through a ton of info. Now we're at our final and maybe most important section, what to do with all this knowledge. This is all about turning awareness into action. So here's the bottom line, plain and simple. If you notice any of the changes we've talked about today, big or small, it's time to make an appointment, especially if you're over 40. Please don't wait, don't brush it off, just get it checked. It is always, always the right thing to do. And look, the process of getting answers doesn't have to be scary. It's actually pretty straightforward. Step 1 is just you noticing something and trusting that gut feeling. Don't dismiss it. Step 2, schedule that appointment. Then you just talk to your doctor. Tell them what you've noticed, your family history, any worries you have. And from there, they'll figure out the next steps, whether that means a mammogram or other tests. It's just a path to clarity. So, there you have it. The key signs, the latest guidelines, and what to do next. We want to leave you with this one final thought. Knowing the signs is an amazing and powerful first step. The only question left is, what's your next one?